Why is addiction a disease? Because it affects the brain on a long-term basis. It affects the functioning of the brain. It alters the functioning of the brain, whereby we lose the capacity to make rational judgments in our everyday life. So addiction is definitely a disease.
Why is addiction hard to overcome? Addiction leads to alteration in the prefrontal cortex of the brain and in person's dopamine cycle. It impairs judgment and impulse control, making it very difficult to make good decisions, and the body starts needing more dopamine in order to function properly. Is relapsing normal? Yes, in addiction, 2 to 3 relapses are normal. Relapses usually occur due to the presence of drug related cues or triggers. It is hard to overcome addiction, but one can definitely overcome it if they are resilient and have a strong social support. Why is rehab necessary for addiction? In rehab, a person undergoes medically supervised detoxification, behavioral therapy, aversion therapy, or cognitive behavioral therapy to rewire the brain and its response to impulses. So, it takes a holistic approach to a long term treatment process along with community support, healthy coping mechanism, focuses on exercise and proper diet.
How does rehab help with addiction, and when is the right time for the rehab? So rehab helps with addiction in a holistic way. So it involves the use of medication management to help with your addiction issues. Along with that, there is a range of other interventions like psychological help, the family help, which is very important to address the issue. And when is the right time to go to the rehab? So the earlier the better, because the longer term effects of addiction alter the brain functioning in significant ways, and the effectiveness of rehab goes down.
How does Cadabums treat addiction? Cadabums recognizes the social and family aspects of addiction as well. It provides support groups for individuals and families too. There is a 24/7 support with immediate crisis interventions, and a multifaceted team of psychiatrists, psychologists, and counselors, along with physicians, play an important role in bringing this holistic approach. Cadabums takes evidence based and solution based treatment plans, which are customized for every individual.